Numbers rising again in the KC area. Most medical experts are relying on prevention techniques that we all know, masking, vaccines, boosters, while also relying on treatments like Paxlovid and monoclonal antibodies.
Yeah, but a Kansas lawmaker wants more access to alternative treatments that don't have the backing of most medical experts. Lawmakers in Kansas and more than a dozen other states have introduced bills prescribing how doctors and pharmacists can practice and what their licensing boards can investigate.
So this morning, KSHP 41 anchor Caitlin Canoe takes the issue 360, talking to multiple perspectives so you can make up your own mind.
Hello. How are you? Good to see you. Oh, do I get the usual hug?
Yes, ma'am.
Oh, thank you.
Dr. Jennifer McKinney was born and raised in Fredonia, Kansas. When it comes to turning to doctors you know for medical advice, she's practically the poster child in this small town. Considering she not only practices medicine here, she's following in the footsteps of her physician father. She says she loves her patients, many she's known her whole life, which is why she says she won't prescribe ivermectin or hydroxychloroquine to treat COVID-19.
I need to know that what I do does no harm first to the patient, and I need the data and research, just like I've done for the last decade of treating patients.
She points to research that shows these medications are ineffective in treating COVID, noting they can also cause serious side effects. So why is this subject even up for debate? In March, a bill passed in the Kansas Senate that would prevent pharmacists from refusing to fill prescriptions for ivermectin and hydroxychloroquine for COVID-19. That bill would also prevent the Board of Healing Arts from investigating doctors for prescribing these treatments for COVID. We're taking this topic 360, hearing from a concerned pharmacist, doctors who have different thoughts on the treatment, a health ethics expert, and the state senator behind the bill. First, doctors say you have to look at the timing of this debate, which coincides with misinformation spread during the pandemic.
I just think there were so many factors, so many voices that were sharing information that wasn't correct, that it made it unclear for people, and they didn't know who to trust.
Dr. McKinney says in addition to social media, people who felt hopeless during the height of the pandemic were scrambling for a miracle cure, including some members of the health profession. Dr. Alan Greiner, a Kansas City physician and Wyandotte County health officer, agrees, but says it's also partly due to politics.
If they're a politician, they have a conflict of interest in that they can get a ton of attention by latching on to issues everybody's thinking about and paying attention to, whether it's on Facebook or whether it's in the news.
One example he points to is Kansas Senator Mark Steffen. The Hutchinson anesthesiologist declined multiple requests for interviews, but has been vocal on the subject.
We blew it during this virus response. Our failure to treat early, and when I say our, I mean mainstream medicine's not mine. I've been fighting for it the whole time.
Steffen was a vocal advocate of the bill that passed in the Kansas Senate.
Clearly now people are starting to see that early treatment's the key, and it's unfortunate that we had this woke crowd of liberals selling their propaganda at the expense of people's lives.
However, Dr. Greiner says there's no propaganda, just evidence-based data, and he questions Steffen's motives, considering, according to the Kansas Reflector, Steffen has publicly stated he's being investigated by the board for prescribing ivermectin and hydroxychloroquine for COVID-19. The Kansas House of Representatives adjourned for the session without voting on the bill, although it could be reintroduced next year. And should it resurface, the topic is not as split down party lines as some might expect.
And let's be honest,
Dr. John Epley of Atchison is a Republican state representative. He's also been practicing family medicine for 41 years. When it comes to ivermectin, he will reluctantly prescribe it, but only if he can't first dissuade his patients.
I stand with probably the majority of physicians and pharmacists that feel like this is probably a marginal treatment at best. There are patients that come into me that insist that they must have this based on what they've read, based on their own review.
Still, he can't support this legislation.
I think this bill goes too far in that it is forcing pharmacists to fill scripts that they may have second thoughts about or not want to fill.
And that's what has many pharmacists concerned. Some say being forced to fill prescriptions could take away their ability to catch life-threatening interactions and ensure patients aren't taking possibly lethal amounts of any given drug.
And when you create laws like that, you're not just taking away the last line of defense from us, but you're also harming your patient because there's no one to do the last check to say if this is appropriate for your patient.
John Carney is a medical ethics expert who adds forcing pharmacists' hands in the matter and interfering with the Board of Healing Arts could be problematic.
Having an outside group come in and intervene is ill-advised, and I would agree. It's ethically. It's certainly not advisable, and I think it was ethically fraught.
This type of bill is not a one-off. According to Legislative Data Service, GovHawk, at one point there were 30 states you see here in blue behind me either considering legislation restricting board authority, explicitly allowing for the off-label treatment of COVID-19, or both. It's leaving plenty of health professionals worried this could set a dangerous precedent beyond just treating COVID-19. Caitlin Canute, KSHB 41 News.
Now, we do want to mention that we've reached out to Kansans for Health Freedom. It's a group lobbying in favor of this legislation, but they did not return our request for an interview.
Neither did another Overland Park weight loss doctor who openly advocates for the use of ivermectin. Do you have a thought about this story, or really any topic you'd like us to give the same treatment? Go 360 on. Email us, 360@kshb.com. Follow us on KSHB 41 social media to join the conversation and offer your input.